Special Needs Network was created in response to the need for awareness and education about developmental disabilities in under-resourced communities. In 2013, 1 in 88 children in the U.S. was diagnosed with autism. Yet, in underserved communities, diagnosis is delayed, an average of 2 years. This delay has devastating effects for these children and families. Along with a group of community leaders, we created a parent-centered organization to help low-income families of color affected by developmental disabilities access treatments and services they need. We know that no one will advocate for a child like a parent. Our focus remains on empowering these families to understand what developmental disabilities are, what treatments are available, and how to take stewardship over their child's care. As the incidence of autism continues to rise exponentially, we have witnessed a sharp increase in demand across our programs. Our short-term objective is to continue to meet this demand for services. We also want to close the gap in diagnosis and care for families who are affected by socioeconomic, linguistic, and other barriers. We would also like to create the first ever Autism Medical and Developmental Clinic in South Los Angeles. This clinic will provide early assessment and interventions to thousands of children throughout the county. Four factors make us successful. First, we provide programs at no charge in the neighborhoods we serve. This ensures that everyone who needs our resources can access them. Second, our outreach is top-notch. We provide a trove of information and resources online, and we distribute it across numerous social media platforms through easy-to-follow videos and pictures, making it universally accessible. Third, we rely on substantial numbers of volunteers. This is cost-effective and makes us consistently present in the community. We go to the people who need our services the most and provide outreach where they live, work, and play. And fourth, in everything we do, we consider who we serve. We are respectful of the cultures and languages of our clients. Our service model is at the core of our effectiveness. Special Needs Network is not an organization that stands apart from those who receive its services. We are community-based and parent-led. Our programs aim to educate and inspire parents on their path to self-sufficiency. Once empowered, our families become more deeply involved, serving as a network of support for one another and a beacon for parents of newly or yet diagnosed children. As they become more aware of the disparities affecting their children, our parents also become active in our advocacy efforts and have helped to change California law to benefit other special needs families. We have grown our roster of programs tremendously and provided resources and services to tens of thousands of families. This has been matched by growth and effectiveness. We have graduated hundreds of parent advocacy mentors, of whom virtually all have reported successful outcomes in navigating treatment and supports. Our annual Tools for Transformation conference has become the largest and most comprehensive autism, ADHD, and LD conference in Los Angeles, bringing together more than 1,000 parents and civic leaders each year. Even so, our true success is measured by the degree to which each and every family we serve accesses the services they need. We continue to focus on improving individual outcomes across the board as our services grow. Few people know the importance of volunteers in our organization. Across all services, we have over 600 volunteers who dedicate more than 6,000 hours each year. This has everything to do with our outreach. Many organizations address the community from a marketing or promotional standpoint, or rely on individuals who are temporarily committed to a cause. Our work is unique because we target parents, grandparents, and family members of kids with disabilities. These people are directly impacted by the challenges we address, and they understand the grief that goes with the diagnosis. They come to feel very strongly about the work we do, so they return to help us with genuine, compelling desire to create positive change. We have served more than 30,000 people and have made the issue of autism in underserved communities a priority for local and state elected officials. As a result, millions of dollars have been invested in nonprofit groups and programs targeted for early intervention services. From an advocacy standpoint, one of our greatest accomplishments was co-sponsoring and advocating for passage of the Autism Insurance Mandate Reform Bill in California, which became law in 2011. This piece of legislation mandates insurance coverage of behavioral health treatments for patients diagnosed with autism or related developmental disorders. Our major challenge has been keeping up with the growth in the rate of autism diagnosis while demystifying what it is and is not. Each year, more and more children are diagnosed with autism or other developmental disabilities. In the communities we serve, this is particularly troubling because there is such a stigma and so much misinformation attached to the disorder. Too many of the people we serve are reluctant to seek out services. They either fear having a label permanently attached to their child or being perceived as bad parents. Overcoming those challenges is a constant struggle, even as new figures show steady rise in the number of autism diagnoses. Additional resources would allow us to expand capacity to keep up with demand. It would also allow us to implement other direct services beyond the work we currently do. Our biggest project is the construction of our Autism Medical and Developmental Clinic, a state-of-the-art medical and educational facility. Additional funding would aid with construction and operation of the clinic and help us provide more direct health-related treatment and services to thousands of kids. One gap we're looking to fill is providing early assessments and critical interventions, along with a range of social services at our Autism Medical Clinic. This center will allow us to continue our parent training activities, provide free legal and advocacy services, and most importantly, close the diagnosis and intervention gap for African American and Latino children with disabilities.